Eyewitness News is your vaccine authority, and we love getting all of your questions. And if you think of one during this interview right now, it's very easy. Just open your camera and scan the QR code that you see right there in the bottom corner, and it will open up a link that you can send us your question. Joining us live right now is Keith Grant, an APRN and a Senior System Director for Infection Prevention at Hartford HealthCare. Keith, thank you very much for being with us this afternoon.
Absolutely, Mark. Thank you for having me.
Well, let me ask our first question right here, because as I said, we get so many of these every day, and I know you probably get them yourself from friends and family everywhere you go. But this one's actually quite timely, with Passover starting tomorrow and Easter a week from Sunday. How can families safely celebrate the holidays this year?
Mark, it's a good question. You know, the CDC recently released some document and some change in guidelines in regards to individuals that's been vaccinated. So a good time for us to appreciate the benefits of vaccination, but also being aware of the individuals within your circle. So, and identify individuals that are highest risk, and ensuring that, you know, it's very well communicated that we understand that this is a pandemic. It is a disease that has significant mortality. So please be safe, be as safe as possible.
A very good point right there. I think it's easy for people to lose sight of that right now as more folks get vaccinated, but we're definitely not out of the woods here. Our next question, what if those getting together are not vaccinated because they can't be? For example, children, what should they do?
Yeah, so masking is still number one. So, you know, identifying what we've been able to accomplish with the vaccine is one, but being more appreciative of the fact that social distancing, physical distancing as much as possible, and of course, masking is so important. And one of the things that we can't stress enough is the fact that if someone is symptomatic, please stay away from your family, get tested as soon as possible, and get treated if necessary.
Would testing help? Should people get tested before getting together?
You know, testing right now, I think the most important thing is if you're symptomatic, get tested. So that's one of the primary things, right? It's not going to hurt to get some form of status before, especially with families that are highest risk, so older individuals, individuals with comorbid conditions. If you're going to visit, definitely, you know, testing won't hurt at all. So having that status will help. But based on the incubation period, it's not definitive. It's not, you know, it doesn't cover that entire 14 days. It's a snapshot in time. So it's most important to keep eye on what the symptoms is at this point, if there's any.
Keith, lastly, I'm just curious. Obviously, a lot of people have one shot already, and they may feel almost like it's a bit of a superpower. Are they protected as each day goes on, even before they get that second shot?
It's a very, very, very good question. Very good point. The superpower piece is what I want to focus on, though. There is increase in immunity. So from day one of getting the first vaccine onward, there's increase in immunity. However, again, you know, it's not 100% protection. And the best protection at this point is to ensure that we're being very cautious, being very aware of our surroundings and the individuals around us. And again, if there's someone with symptoms, if you develop symptoms, please take away.
Okay. Keith Grant from Hartford HealthCare, thank you so much for joining us this afternoon and for all that you've been doing over the past year. We certainly appreciate it.
Absolutely, Mark. Have a good weekend.
You too. Thank you very much.